is our first meeting since you're officially here in Pittsburgh. And it's great to see the whole team. Some of you are recognized, but not everyone. It's great to see them here. But it's also great to see all of the McGowan faculty and staff here as well. So I see for sure Ron and a few others that I recognize, but it's good to see this new and integrated and exciting direction for the McGowan Institute. Lots of things have changed over the last few months, so I want to be very sort of straight with all of you. McGowan Institute is a premier regenerative medicine institute by reputation, and I want it to be the #1 regenerative medicine institution in the world in 5 years. Whatever those metrics are, you have to hit them. And I know you will, because of all the talent that's here in this room. What will that take? Well, obviously that takes leadership, that takes talent, and that takes resources. And I believe we have all of that here in Pittsburgh with Pitt and UPMC. In addition to extraordinary research talent, we now have the ability to, could hear okay, right, before? Yeah, okay. In addition to all the extraordinary research talent, what we're also doing going forward is integrating all of the work that could happen here immediately into clinical care. And that is part of the new model. And Gail would be the great example of that, who will take almost all of the discovery component of wound healing programs straight into clinics of diabetic wound and other types of wound healing. So that's an example of what I think we can do. McGowan has been extraordinarily successful in doing discoveries, developing devices, startup companies, commercializations. What we're going to add now, not only to double all of those capabilities, but we're also going to add McGowan discoveries going directly into patient care here at UPMC. So it's a paradigm shift in some ways, but it's also future for medicine and medical research in some ways. And that's really what I want to see happen here. We've had some miscommunications, perhaps, fears, perhaps, anxiety about what this all means to McGowan. And I'm here to reassure you that McGowan will be a premier institute in the School of Medicine at Pitt that supports multiple schools and reporting directly to the Senior Vice Chancellor for Health Sciences. So it's not some afterthought, it's not some vestige that we're going to sort of let it go. It's not going to be Chandan's new institute. It is going to be McGowan with Dr. Sen as the new director. So nothing changes in terms of its importance, in terms of its growth, in terms of its foundational support, and its reporting structure within the university. Resources are going to double, roughly, for the McGowan Institute. What that also means, productivity needs to double. Accountability needs to double. And that's how I operate. So, with that in mind, I'm very happy to be here, very happy to launch this new direction for the McGowan, for regenerative medicine, for all of the great things that have happened here before and will happen in the future. So, thank you.